Today's going to be all about alignment principles, mainly for injury prevention. So something to really be mindful of, you guys, especially if you're women. What happens a lot is we tend to throw our pelvis forward. Our head is forward, shoulders are forward. Everything is pooched out, and essentially we're just hanging on our bones, right? And we're just walking around with no awareness to the posture. And so I really want you guys to really push the pelvis back, respect the lordotic curvature of your low back. When you do that, you're gonna almost always throw your ribs forward, flaring them forward. So I want you to pull the ribs down. And when you do that, don't throw your shoulders forward because that's going to create this flexion of the spine. But I want this to come down, and then I want you to feel the lifting of your spine. Very hard to do, to stand upright and to retrain our transversus abdominis, the multifidi on the back, and of course the pelvic floor I talked to you guys about. It's going to meet the intra-abdominal pressure based on the diaphragm up at the top. That makes up for the four core musculature. We learned how to activate them up against gravity yesterday in a seated position, but I also taught you guys how to do or connect with your breath and use the accessory motions that it creates to connect with your core, lying on your back with gravity eliminated. So I want to start out by telling you about kinetic chains. We study a lot in physical therapy, kinesiology. Static motion, we're never just static, right? We're meant to move. And so I really need you guys to really focus on the heaviest part, this aponic region of the pelvis, that it's not thrusted forward, that you're not just hinging on your bones. Typical pattern is this: hips forward. It's almost a fashion forward way to stand for like models, because that's how they walk, right? On the catwalk. But I want you to pull it back, create this nice curvature of your lumbar spine, pull the shoulders down. Remember I said the right shoulder blade in the left jean pocket, left shoulder blade into the right jean pocket. Pull, don't thrust your rib cage forward, but pull it down while maintaining the lordotic curvature. But here's another thing. Pull the tailbone slightly down toward the floor. It's going to give you this surge of a lift. So we want the body to be integrated because the shoulder girdle, which is also a ball and socket joint, as well as our hips, are connected to our spine or our core. Right? Shoulders up here through the scapula or the shoulder blades, and then the hips through our pelvic bones. Something that I will mention is when the center of gravity is thrusted forward and everything is not lining up, it's going to create malalignment dysfunctions. You guys all have cars. If you live in this modern world today, we routinely get alignment checks and suspension checks in our car for the tires. And you guys have all run over a bump or so, or two, and it tends to malalign the tires. And when it does that, one side of the tire, one of the four, gets worn out quicker. So we're advised to rotate the tires, right? Not only that, to make sure that they're balanced, because if they're skewed just a bit, it's gonna wear out a lot faster. So I want you guys to think about that in the context of yoga. We're not only asked in yoga to stand with our feet straight vertically, but it's a dynamic motion. A lot of the times we're asked to put weight on our hands. So let's talk a little bit about our kinetic chain. I want you to remember a lot of people have knee issues. Almost always it stems from the ankle dysfunction, ankle and the foot. And if you look at the surface area of your foot supporting the full weight of your body, it goes to show how important our foot functions are. A lot of us end up with flattened arches. We have what's called supinated supinated, where we're open in the pelvis, where the pelvis is thrust forward. And it's almost an issue for us here in the United States, especially because a lot of us are women of child rearing ages, and we gave birth and we stayed externally rotated at the hip, so much so that our feet are now everted, right? It's almost in a supinated position. And so we walk sort of like this, right? And it's a thumping action. And we're just really giving into this gravitational force. Something I want you to remember about the foot is it's designed to absorb shock. And so we want to be light in our feet when we walk. And that's all being supported by the core. Remember, we addressed the core yesterday. I told you the 4 core musculature, they are designed for endurance, right? They're the slow twitch fibers that are supposed to hold us up against gravity to have this decompressive force in our spine. Why that's important is through the spine runs electrical circuits from our central nervous system. This body of ours is so magnificent. And we've got hardware and software to run this circuit, but nobody's born with the ability to, with a manual to operate our body. And so it gets programmed by poor habits, motor-wise, postural-wise, and we have these adaptive mechanisms where everything became so posturally insufficient that we're metabolically insufficient and we're not able to detoxify properly to create such a toxic system within. And then you come to a yoga class and you're asked to do all kinds of poses without proper awareness. So I want you guys to know, I believe yoga is powerfully healing no matter where you start. There is never a right or a wrong way to do or practice yoga. I want you guys to be, though, very mindful and be infused with the knowledge enough to handle your body to minimize and prevent injury. Because the motor functions will catch up with you, but only if you bring awareness to the dysfunctions that you're living with, and then the adaptive patterns that you recognize now will help you to correct so that you can align yourself better. It's like you're doing an alignment check in your tire system to make sure that you're straight and upright. So a little bit of a fact check is in our foot, there's 26 bones. And then there are 33 joints and then 107 ligaments to support our locomotion. And what do we do with those bones? If you're a woman, we all owned a pair of stiletto heels. We're always lifted on the back. I'm really petite, so I like the platform shoes. And we get shortened and we have adaptive shortening. So in yoga, with already a dropped inner arch or arch of the foot is already dropped. We have flat-feeted people with plantar fasciitis issues, which then ultimately goes up to the kinetic chain to affect your knees and your hips. And I can tell you, anybody who has knee issues, and I have a lot of women who have knee issues, it's not just isolated at the knees. We have to look at the whole kinetic chain, and it's almost always a dysfunction of the hip. So again, hormonally we're affected. It affects our flexibility into our joints. It can cause stiffness, cycles, hormone cycles can do that, as well as I mentioned about the extracellular matrix, the fascia being a part of that. That can create lots of snotty-like tissue. If you can think about fascia as a very important tissue with a lot of nerve endings, receptor sites, to be aware of the tightening and then the restrictions and then the adhesions that we all have, it's very prone to inflammatory processes. So again, I want you to think about your body as both the physical with the laws of physics that apply to it in movement-wise, but I want you to also understand the biochemical basis for muscular contraction. Super important because we need the electrolytes, we need the nourishments, and we need to be able to, for the muscle fibers to contract and relax, we have these biochemical reactions that needs to occur for that to take place. So all those things to say, I need you guys to be properly balanced and positioned on the mat. And I want to start with our feet today. Looking at our feet, making sure that, you know, when we do, let's say, Warrior One, for example, I want you guys to make sure to learn to grip the mat with your feet. So standing nice and tall, place your feet together, and that's really minimized your, what I call the base of support, right? The way you're standing. And hopefully by now you understood that you don't push your pelvis forward and just hinge on your bones. And again, with women, a lot of the times it's the left hip that gets the wear and tear, because when we have babies, I was one of those women too, is I used to have a baby in the left hand to allow me to do everything else with the right? So that's how we sort of adapted. And then when we adapt a certain posture, we create imbalances and asymmetrical motor patterning to affect the whole spine, up the chain, down the kinetic chain. So again, let's review the aponic force. This is the pelvic region. It's supposed to be anchoring us down and rooting down. And also this region is what? We've got holes down there to allow us to defecate and urinate, right? And so that needs to be rooted down. But from the navel to the crown of the head, I want there to be a surge up. And I want you to see if you can pull the shoulders down and away and feel this lift. And then one more thing I want to say is lordotic curvature. I don't want you to be anteriorly tilted so much so that you cause a sway back here. I want you to tuck and respect your normal curvature. Place your pelvis over your knee and your ankles, but then also your rib cage does not flare forward, but pull it back without thrusting the shoulders forward. So shoulders have to roll back and down, right shoulder blade into the left jean pocket, left shoulder blade into the right jean pocket, pull the shoulders down and feel the surge and the energetic pull from the navel up to the crown of the head. I want you to really think about that, okay? And then I want you to lift, look down and lift your toes up. Let's have your feet shoulder width apart and then see if you can lift your toes up, okay? All 5 toes. And then place them down, but I really want you to flare out all 5 toes and then place them down. When you do that, you create this arch underneath. And then I want you to think about that place under the big toe and then the place under the pinky toe. Those 2 points. Follow that line on the middle of the foot towards the heel. Extension of the big toe down to the calcaneus on the middle of the foot. That's the 3rd point, and then follow the pinky toe back towards the calcaneus or the heel, and then that's the 4th point. And then see if you can bring awareness to those 4 points and make sure that they're even keel. That you're not really standing on the outsides of your feet, because that's gonna, when you do that, like lift the toes up, the big toes up, when you do that, you're gonna feel the imbalance into your hips. It's not just at the foot, right? And then when you turn and place the big toe down and lift the pinky side up, you're gonna feel the inner thigh chain going down from the pubic bone all the way down. So I want you guys to think about evening out the 4 points of your feet and think about it all the time when you do yoga. You can lay the toes down, but I want you to see if you can grip your mat with your toes enough to where not only do you have stability in through your feet, but all those muscles and ligaments are a little bit activated to support you so that you can stand tall. The other thing that I want to tie in with what we discussed yesterday is when we do activate the core, it's less loading into our hips, into our knees, and into our feet. As the joints go down, notice how it gets smaller and smaller and more fragmented as you get into the feet, right? Because remember, the pelvis is the biggest bone, which is connected through the pubic bone at the front, and then the sacrum, sacroiliac joint on the back side, right? And then it's connected to the biggest joint, which is our hip. Acetabulum, it's the concavity region of our pelvis, joins with the head of the femur, that's big, goes down to meet the patella, as well as our fibula on the outer side of our shin, and then the tibia on the inner side, going down to make the malleolus, the little bone that sticks out on the right and the left. Tibia on the middle and fibula on the right. So as you can see, it kind of breaks down. Big bone of the femur, and then tibia and fibula, and then down into our feet. What did I say? We had 26 bones, 33 joints into our feet. So you have to understand that this is designed not to bear the weight, but to absorb the shock. But another thing I mentioned about the feet is we wear shoes all the time until we start yoga. And then all of a sudden we're asked to take off our shoes and learn to learn the proprioception through our feet and learn to have sensory integration enough to have proper posture without really learning what proper posture is in yoga. We're so focused on the poses that we forget all the adaptive shortening and then the imbalances and poor postures that we bring to the table to seek yoga when it's supposed to heal us, never cultivating that proper awareness. Yet we're asked to learn all the esoteric aspects, and a lot of the teachers will assume that position and the role. And the power of yoga teachers are so huge because I've seen very great vinyasa teachers that are like super popular. No body awareness they have great body awareness in their own ability, but they have very little anatomical understanding that they're thrusting their bodies in ways that's not aligned properly, that it might look beautiful today because it's something that we all want to be able to do, but you have to realize a lot of them are moving their bodies in ways where it's causing adaptive shortening and adaptive lengthening, where our muscles get stuck in those positions. Because again, when we have length, let's say some people have extensive flexibility and they have length in their hamstrings, for example. Sometimes the muscles are supposed to contract and they're supposed to lengthen, right? And it is a phenomenon with adaptive shortening. Some muscles get stuck in a shortened position while some muscles get stuck in the lengthened position. So let's talk about that a little bit. So this is what I see. In physical therapy, we do what's called a static postural assessment. We do a dynamic assessment, and we test for strength in individual muscles and joints. That is a problem for many of them. Anyway, so I'm going to bring it back and talk about, what was I talking about? Adaptive shortening and lengthening, and they get stuck in that lengthened position and then shortened position. And I was going to show you a classic thing. In physical therapy, I was telling you how in a postural assessment, it's a static assessment where they're not moving, we just assess their posture. Almost always, I see forward head, forward shoulders, and a posterior tilt. It's the tucking of the pelvis. And when you're doing that, the posterior chain on the back side is completely lengthened and weak. And then the front side, like the pec minor and major, super tight. And then the scalene sternocleidomastoid near and around the sternum, super tight. So this adaptive shortening is here, and then we're doing all kinds of, yoga things, and that's where we create a lot of injuries. So Having said that, I want you guys to pull the head back. Let's interlace our hands and put it behind your head. And see if you can bring your elbows forward and then pull them way back to where you can't go anymore. And see if you guys can learn to bring awareness your pelvis or your rib cage to where when you pull the elbows back, that you're not thrusting and getting the range from the thoracic spine by compressing your lumbar spine. Okay, so pull the rib cage down, but still push the head back to strengthen that area between the scapula, lengthen the area in the pecs, drawing the tailbone down, strengthening the core. So the core is typically lengthened, and then the shoulders are forward, so the space between the scapula is typically lengthened. And this area is super tight, as is the low back, is a typical thing that I find in almost any patient. It's a spectrum. Some people are a lot more so. Some people are just slightly causing irritations. So this is where I want you guys to bring awareness to your proper postures. So I just want to make sure you guys understand the concept of that. And now I think I covered all bases, so I'm going to look at your worksheet and make sure I am not too far off. So mindless alignment versus mindful alignment is an awareness that I need you guys to cultivate. Super important. And when you have mindless alignment, this is filling out your sheet, you're like a rag doll and there's no juice. Juice meaning electrical circuits from your spine to innervate the muscles, to activate those muscles, to shine on, to create that contraction, lengthen, synergistic activity in the body to give it juice to the body, right? That helps with our vascular supply, nerve supply, lymphatic system, which helps our immune system. So everything is sort of interconnected. So I want you guys to think about integrating those principles. And I call this hanging on your bones. And when you hang on your bones long enough, like a rag doll, not only does your muscles atrophy, but the connective tissue, like the ligaments and the bursas, they start to tear. That the fascial structures that they start to tear creates a lot of receptors that to cause pain. And eventually when you go visit your orthopedic doctor, they're going to want to do surgery on you. It's not what you want. Also, the pelvis pushes forward or side to side, like I told you. Minimize that and make sure you learn to stand on both feet. Bring awareness to your feet and understand that from the navel to your feet down is rooting down by activating your muscles. How you activate your muscle in Bikram, we're asked to lock out our knees a lot, especially when we're standing on one foot. I want you to lock out your knees and then come out of that locked knee a bit, and then really try to push the knee back, but activate your quads and hamstrings isometrically. So bend slightly your knees, and then straighten and see if you can squeeze your quads and your hamstrings. While you do that, I want you to press up with your toes, all 5 toes, and splay them out. And think about in the sole of your feet, underneath the big toe, sole of your feet, underneath the pinky toe. Those are 2 points, right? One on the inner arch, and then one along the outer. And then come toward the heel of your feet, and on the middle side is 1 point, and on the outer side is the other. So think about the 4 points and see if you can push back, and then push the hips back forward enough, but back enough to where shoulders can line up with your pelvis. Draw your head back so the jawbone can line up with your pelvis as well. Without arching your back, draw the rib cage down without pulling the shoulders forward. So pull the shoulders back and down. That's sort of the awareness that I want you to have. And as you move dynamically, things will shift and things will change, but at least you won't be hanging on your bones. You're able to mindfully activate the proper muscles to be able to engage with them. And once you learn the proper ways to do that, you'll be able to have better cues to therapeutically fix people that come into your classes with adaptive shortening. And more importantly, you'll have the ability to train your eye to assess those patients or clients that come into your class. So when the hips or pelvis is posteriorly rotated like this, the hips, if you touch, it's very lax. There is no juice to it. But when it's active and pushing down and engaging my core, the hips, the gluteus maximus, minimus, and medius, they're able to lock on and allow for a balance between the psoas muscle, the hip flexor on the front side, along with the hip extensors to protect the low back. And drawing in the transversus abdominis provides a lift in the spine to provide more connectivity from your central nervous system to the respective muscles. I know it's a lot, and I tend to really hone in on this because it's an important concept you guys need to know, and I promise. The poses are coming, and so we'll get moving soon, but I wanted to make sure that I'm going over everything. And I want to just make mention that learning to stand mindfully aligned is very humbling because habits are so hard to break, and you're going to learn that that's the case. And our bodies are designed to go in the path of least resistance. So it's going to resist the changes that you're trying to make because it likes to hang on the bones when it's effortless versus effortful to learn new neuromuscular pathways. But you must be mindful in doing that. And you can still look great doing yoga while winging it because, again, we like to compensate and go really fast and just hang on our bones, but it can cause long-term injuries that you'll ultimately end up in the doctor's office. And like I said, yoga injuries are huge, so I'll never be out of a job if you guys keep doing that. But when mindfully aligned, our core activation is kicked in, front rib cage is threaded in, and the navel is pulled into the spine. Okay? This creates a lift of the spine and crown of the head reaches up. Everything I said, right? I just want you guys to refer to the worksheet. So this is regurgitated information that I want you to really, really get. At first, the body will resist mindful alignment because it loves efficiency and the path of least resistance. When our joints are repetitively used without proper muscle activation, they'll start to wear and tear, like the tires of our cars. Our joints are meant to last us for life, so it's in your best interest to keep them healthy as long as possible. That means learning to activate. Put some juice into them. I like to use the example of a door hinge. Mindless alignment is like a door hinge with loose screws. You open the door and close it, and it'll open and close. One of the screws fall off, and then it'll be harder to open and close, and then eventually other screws will try to dissipate the gravity of the evenly displaced screws, and then eventually you can't even open and close that door anymore. And that's what happens to our joints, and it's important to keep in mind. Not to mention, when you damage your joints, it's very painful. Okay? And when you master mindful alignment, the joints begins to float into poses because less strain to the joints, and also because the body is aligned. When your body's aligned, these yoga poses become very effortless because you become so much more efficient. So I promise you, this can be a hard road ahead, or it would be seemingly very difficult, but I need you guys to be internally so connected that you can externally look and be really responsible at engaging with your body in ways you haven't been doing before. So I mentioned everything, so let's go over a few poses and let's learn it in our body. Okay, so the first thing that I want to speak about is let's talk about the shoulder girdle. Computer so much. A lot of people come with carpal tunnel injuries, and a lot of people just like to put weight into that area, the wrist joint. How you get away from that is to make sure on hands and knees, right? I want you to see if you can bring your elbows, right? So you spiral the biceps forward and triceps back by bringing the soft or the inner arms or forearms sort of together so that this cubital fossa or the elbow fossa here, they are facing each other while having your hands planted, right? And then your wrist joint needs to be right under the shoulder. And then I want you to see if you can create the arch of your hands by putting more weight on the base of your metacarpals, base of your fingers here, and then putting weight through the fingertips to have sort of that arch under the hands, and that's going to help you to dissipate the weight onto the wrist. Not only that, if you are sinking into the shoulders, that's really, really hard, right? Because I'm hanging on my bones. But if I can lift and really create this lift from my core and align my joints, then it's less of an issue to be on my hands. But I will tell you, many of you are too weak to be doing downward dogs or even especially chaturanga. So we're going to kind of push back into our down dog, and let's talk about our hand position and our feet position. So I talked about the anterior tilt of our pelvis, right? Creating this lift because we want the downward dog to be going from the ischial tuberosity, the sits bone, all the way down to the heel, right? When we do that, a lot of the times, if you're too tight and your lumbar fascia is too tight, we're gonna round our backs and kill our shoulders in this way, alignment-wise. Heels start to lift up, and this is not so good for your low back, right? So I advise in my classes to bend your knees a lot to create this anterior tilt. So leave the lumbar fascia out of it and get the stretch where you need. It's the anterior tilt is what you need. Push the floor away and then lower one heel down at a time without rounding your back. Because when you round, look what happens to my shoulders, right? Everything gets malaligned. So I want you to bring the heel down one at a time until you're able to do this with the anterior tilt of your spine. Not only that, look at your hands to make sure that you create this arch along underneath the surface of your hands and push, push, push. Continue to spiral your biceps forward and triceps back and push the floor actively. Create this anterior tilt. Even if you have to bend your knees a lot, this is what I want you to create. And then learn to lengthen with the breath to try to change the myofascial stretch so that when you do that safely and mindfully, you get this permanent lengthening safely and you're not tearing anything. So slow, intentional stretch is so much better when we're thinking about fascia and adaptive shortening. And we want to create this anterior tilt of our pelvis to allow the hamstrings to lengthen, because again, our spine is something that we want to protect. And we see a lot of hamstring pulls and tears, and that's because the muscles and the fibers in the fascial structures get so weak, and that repetitive injury, it just gets so weak, and it just in a stretched out like micro tears over time, it creates those collagen fibers to be so weak that one day it just, when the rubber band is stretched out, one day it'll just be so easy to snap. That's how I want you guys to think about your muscles. So don't feel like forcing yourselves into a stretch, a split, or anything like that is a good thing. If you're structurally not able to have that kind of a length, it's something we can cultivate and understand our structural limitations to allow for ease of movement, understanding the end goal is to safeguard the longevity of our joints if you can have that overarching goal for yourself and to learn the process of yoga is your own individual healing journey, that will be a great thing for you guys to really understand. So now I want to talk about forward folds. Okay, a lot of the times when we're doing forward folds, people are stuck here because again, what do a lot of your clients do? We're seated at the computer, we're completely posteriorly tilted because when we're sitting, we're like this, right? And we just get so much in our head that we forget about that. So almost always, I want your focus to be to get them up into an anterior tilt, getting this nice lumbar curvature here to do a forward fold this way, keeping that chest open, not having a localized bend, and then the stretch is coming from higher up. Because if this is tight, it's going to try to get it up the chain. That means higher up in the thoracic cavity almost always. And so you see a lot of patients like this, right? What are you stretching? So that's not doing any good for them. And then a lot of the times they'll just really force it, but what they're hurting is their low back, they're shearing their spine. It's gonna cause some irreversible damage. So the way we teach it in our studio and our center and teacher training is to keep your shoulders back and then have contact with the front thigh and then sit there for a bit and then breathe using the breath. See if you can continue to have the contact between the belly and the front thigh and go forward that way, okay? And if you can't even do that, I'd much rather you be back here because again, if you're so posteriorly tilted that you can't do that, the other thing is, I'll bring a block in a minute, but I want you to lean back and practice. Have them practice going into anterior and posterior tilt that way using their abdominal TA muscles. Inhale, chest up, exhale down, and teach them the ranges in the pelvis because them being aware of the alignment in the pelvis as being the key indicator for up the kinetic chain and down the kinetic chain into our hips, knees and ankles and up the chain, like it's super important, the pelvic region. So I want you guys to like get it in them here and then perhaps they can go forward, okay? The other thing that I'll show you is with the block. You can get a block and you can sit on it. And from this place, they might have to be wider, might need to be wider, but this immediately allows them a lot of room in this pelvis to where they can have this anterior tilt. And this can go for wide-legged forward fold as well, because it opens up the pelvis to allow for this anterior tilt. And from here, they can perhaps keep their knees a little bit more straighter and then go this way. Do you see how it's easier? I want you to try both and make sure you understand how to use the blocks in this way. Almost always, if you can elevate their pelvis in this position, this is really, really good. And when you're going forward, I need you to be squeezing the front chain to release the back. Our body's always pushing and pulling. There's this polarity going on at all times. It's one of the pillars of our alkaline method is understanding this polarity at play. So if you can squeeze the abdominal muscles, it'll help to release the back. In the same way in the thigh bone, if you can squeeze your quads, it'll help to release the hamstrings. And then you can use your breath and make sure you're mindful of your toes because a lot of the students, what do? They're externally rotated and now I have to ask you, what are you stretching? Because you're creating this external rotation, it's a torque in the hip in such a way to get potentially some damage into the bursa. It's not what you want. So always know how to align. When the toes are up, you're gonna feel the more of the fascial stretch on the back. It's more of the nervy stretch, not the muscular stretch, but it shouldn't cause any pain. And then you start to extend and try to activate the quads to strings and just breathe into it. And then when you do that with gentle intention, you never have the ability to rip. You go slow. And it's able to make permanent changes. The length comes back. And of course, you want it to retract back. That's how muscles work. So it's not that you wake up and all of a sudden you have so much length. And if you do, you should be cautious. I know a lot of flexible yogis that have hypermobility issues, which they're creating. They're tearing their fascial area, especially on the back side, so much. If you look closely, either their paraspinals are so tight to accommodate for that, but there's compensation going on. Because when you have too much flexibility in one area of the body, there has to be a compensatory mechanism and adaptive shortening for the body to sense that it's dangerous to be too loose, so it'll tighten up in the opposing areas. And so those concepts are a little bit far beyond the understanding and the context of this lesson today. But I want you guys to understand sort of how our bodies work. And if you don't know that, you need to take the time to understand it, to minimize pain, so you get the full benefit of the yoga practice. So next I want to talk about, let's talk about Uttanasana. So that's a forward fold, right? So coming forward. Up until here, I want you to think about, it's the hinge of the hips that creates this forward fold. But what do you guys see a lot? Is a lot of the times people are doing this. And so you have to really understand that that's a lot on your low back. And one day the discs will slip and slide and cause shearing long enough with a tight fascial structures here with not enough core stability on the front chain that it's going to tear something up. So you always want them to push the hips back, create this anterior tilt, and again, same concept, draw the navel or the soft part of your belly down so it's in contact with your front thigh, and then have your hands, or you can use the block to have them be here. And then from there, I want them to be here. So release the low back. What did I say? I want you to really pull in the core to release the low back. Understanding that the hinge comes from the hips. And eventually, yes, your low back will round, but it won't round like this where it's causing a localized shearing in the thoracic spine. So as you come down, ultimately, you won't be straight flush. And if you do see that in some yogis, they probably likely have compensatory patterns because our bodies are not designed to fold in half exactly. So I want you to come, continue to push the hips back, and then squeeze your thighs, front thighs, to release the back, and then squeeze the core to release the back muscles, and then see if you can bring the toes up to kind of light up the back side of the fascial structures. And you feel that sciatic nerve and then the fascia stretching before you feel the muscle stretch. And you kind of want to breathe into that space. So again, from here, you want to go ahead and kind of come down, take a breath, and alternate straightening the knees to allow for gentle release of your low back down. Does that make sense? And then we're going to come straight up, not long lever arm up this way, but come up, roll up, one spine up at a time. And I'm just thinking about what else I can show you. I want to now show you chair pose. So again, I want you to stand with your feet shoulder width apart, and I want you to bend your knees. And when you bend your knees, I want you guys to think about, because it's the relationship between your feet, your knee, and your hips. So when you sink your hips down, you don't want to be sinking with your knees going forward, because again, that's a shearing force. You're at a mechanical disadvantage. You're going to blow out your ACL, meniscus, or anything else in between. It's just not a smart way to do that. So when you do the chair pose, I want you to stay higher up until you're able to keep the knees behind your toes. And I almost always think about the 4 points of your feet, and I want you to push down more towards the inner arches of your feet. And I ask my clients to always raise the toes up, because when you do that, what does it do? It really activates your front chain of your shin, which is your tibialis anterior, and it really makes a difference in really creating that arch and activating the muscles of your feet. Alternatively, I want you to push the feet down and see if you can grasp with your toes the mat and see what that does. And that's going to really create more activation on the back side of your, posterior chain of your thighs and your calves, right? So sinking down, I want the hips to go way back. There's this anterior tilt, but like I said yesterday, pull the rib cage down, tuck your tailbone slightly under, and it really should take your breath away if you guys do the chair pose correctly. Pull the shoulder blades back without thrusting your rib cage forward. And it really binds all the musculature to stabilize you. When you look down, your knees are behind your toes. And practice putting more weight towards the inner arch of your feet. And really that creates a lot of activation in through my thighs, quads, as well as the hamstrings, and come up nice and slow. And you can practice that and make sure that all those things line up, right? I'm not going to talk too much about flexibility because tomorrow I'm going to bring in the flexibility component to draw your awareness to your arms and your legs, and how to stretch with activating your muscles to create that length in a safe way. But now let's move on to Warrior One. So I want you to step forward with your right foot, and I want you to make sure that the pelvis is squared forward. The back foot will need almost always to be internally or slightly out. What I started to say is it needs to be slightly internally rotated at the hip with the toes slightly in. And then the front foot needs to be straight forward, like parallel with the side edge of the mat. And I want you to look at your knee and make sure that that knee does not go past your toes, because I see this a lot in yoga. And that's so bad. Pull it back. Even if you have to have a wider stance in Warrior One, I want you to torque the pelvis forward, really understand the torque that you're feeling into your hip, and don't go down too far, because as you go down too far, you're going to create this hyper arch of your thoracic spine if you don't have enough stability into your hip. So pull it in, really get the core engaged, get your alignment in order. And I want you to, in this position, don't go too far. Place your right hand on the outside of your knee and just make sure that the patella is tracking with the second toe. It lines up with the second toe. And really light up your legs as well as your core. So your thoracic spine and your rib cage is straight forward, pelvis is straight forward. Energetically. Some of you might have restrictions to where this needs to be a little bit far, but I always say in the direction of the pull this way. So energetically always aim to go forward this way. It might help to bring the feet closer and not go down too far, meaning don't bend your knees all the way down, right? So you can adjust your range of motion, the depth of the pose, as well as to bring on a little bit more awareness to turn on the muscles in less of a deeper pose so that you can bring and connectivity into those areas where you know you're doing it properly. And when you do them properly, guess what happens, you guys? You start to sweat like I am, and you really feel it into your muscles in ways that makes a huge difference, like you are strengthening the proper muscles. and getting a proper balance. So let's go this way. We're gonna hinge forward and sink our hips. Make sure you're not sinking forward. Again, pull back. Always left and the right side will always be different. So really recognize that. Tracking the left knee now with the second toe and then going down and making sure that that stays right above. Energetically, the back hip is pointed forward, drawing the rib cages down, but don't bring your shoulders forward. Pull them down and back. And tomorrow we're going to talk about the shoulders, to talk about the range of motion. And then come straight and come back. I hope there's so much that I would like to share with you, but I feel like I gave you a lot. So I just want to kind of wrap up in talking about how you have to have the core activation. You learn not to hang on your bones. Make sure that the pelvic structure lines up with your ribs and that rib stays threaded down to support your pelvis. And your head is in line with your pelvic bowl to not displace the weight or center of mass forward or back in ways where you cause adaptive shortening in your body. The main thing to remember is the kinetic chain from the heaviest part, the saponic area of the pelvis, how it roots down from the navel to the both feet, and then the navel to the crown of the head going up. You want to be mindfully connected with your posture, knowing your body in space so that you can preserve the longevity and the health of your overall body as well as your joints. It helps with your metabolism, respiration, and everything else, you guys. So I hope this was helpful. If you have any